Welcome to the Indian Sun. I'm Indira Lystrom. My guest today is Dr. Raj Khillan, Director and Paediatrician at Western Specialist Centre and an inspiring leader for healthcare in the Victorian multicultural community. Dr. Raj is here to talk about COVID vaccination and children. Welcome, Dr. Raj.
Thank you very much. Thank you, Indra, for giving me the opportunity to connect with the audience over here. Thank you.
It's our pleasure. Let's start with the latest news, which is Australia's medicines regulators' announcement that Pfizer COVID-19 vaccine has been approved for children. My question to you is the Pfizer vaccine safe for kids?
Look, let's take it, this way. Whenever any vaccine comes, we always start, as a phased trial. First a trial is in the lab, then in the animal, then in the human beings, and it is always started with adult. And then once the safety is confirmed in adult, then slowly we start reducing the age, like in adult for more than 18. Then we went from 60 to 18. And then same thing with the COVID, we went now from 12 to 16. And I won't be surprised if down the track by mid next year, we are reducing this age down to like a flu vaccine up to 6 months. So when it comes to the safety profile also, and that all comes from the safety profile, if we are confident, safe to use in adult, and children are the young adults, this is how we grow over the age. So body is the same. There are some differences in the immune response and some differences how our children body react to anything. So taking everything into consideration, when we look at the safety profile of COVID vaccination, particularly when we talk about the Pfizer, and in adult, it has been a very safe vaccine. And all over the world, whatever data we have so far, it is safe. And similar way in children, the trial, the biggest trial was done in USA, where 2,260 children were enrolled, and it was found to be a very safe vaccinations. And you can say there are side effects, which is almost the same as happening in adult, in form of having a mild temperature, feeling bit sick, malaise, headache, body ache, muscle pain, and that type of reactions can happen, which is a more of a mild systemic reactions, similar to like you can say mild virus infection reaction. Then it can have some mild, you can say where the vaccination is being given at the site, local reactions, and that is in form of pain, erythema, and whether you are able to use your arm, because of the pain. So when it comes to the systemic reactions, it's almost the same as compared to the adult. When it comes to the local reactions, it is slightly high incidence of local reaction because the children immune response is much stronger. And that's why in the study seen, some children have shown a little bit of a bigger sort of a erythema or swelling around the site of injection, or may have a trouble using that arm for a day or two because of the pain. So this way, but it is, again, it's a matter of day or two, and eventually, you come back to normal and everything is normal. It does not lead any permanent damage over there. The couple of rare, very rare, which is, you can say, serious complications has been seen, and one is the inflammations to the heart. What you call is the myocarditis, the inflammation of the heart muscles, and inflammation of the pericardium, which is the outer covering of the heart, which is called pericarditis. So, and it's very rare. If we say it's so rare that it is, with the first dose, it's seen around 4.4 cases per 1 million dose. and with the second dose is 12.4 per 1 million doses. So it's more common with the second dose than with the first dose of Pfizer vaccine. And the rare cases which happen, and majority of the time they are mild and haven't led to any mortality, any death, and is being safe. And even if there's need for hospitalizations, can be managed safely. So overall, we can say if it's a systemic reaction happen because of the strong immune response of children, it is generally very not a life-threatening, and it is safe and it can be managed. In general, you can say it's a very safe vaccinations to use in children. And in looking at the safety point of view, this is what I was talking. A couple of things has come up now. Can we use this because it's so safe? Can we use in a children less than 12? Because in Australia, recently, last week, TG has approved to be used in children 12 years and above. But in Israel, already started recruiting children from 6 months to 12 months on. So that has, as I said, we always go with the history starting from adult, and then the age started dropping down as we are very, very confident with the safety in different age group. And the youngest age group, less than 6 months, is the last to recruit. And that's the recruitment has started. And I won't be surprised, as I said, then by maybe early next year, we will have vaccination reduced down age maybe for 6 years. And even then further than we can maybe reduce down to 6 months. Mm. And even as I was talking about the vaccination immune response, because the immune response in children is generally very intense and relatively strong, particularly in adolescent age. And that's why the local area, the erythema, the swelling, the pain may be relatively more than adult. And that's why now the trial is also coming up, whether rather than giving 2 doses, only 1 dose may be enough in children. Mm-hmm. So and it will also reduce the chances of a second dose induced heart complications, heart side effect, inflammation of the heart muscles and the outer lining, because it's more common with the second dose. So it's also coming up down the track. It may be 1 single dose in adolescent between 12 to 16 or 18 years of age may be sufficient. But yes, at this stage, the data is very limited. It's in a research stage.
Okay. So what you're also generally saying is that there will definitely be 2 doses required, but down the line with more research, maybe just 1 dose, right? Now, how long does the immunity also last? That was the other question.
Look, it is very difficult to say how long the immunity lasts because we don't have the longevity data at this stage. So what we know is the vaccinations has been given in last, you can say, around 5-6 months. So late November, December, in USA, the vaccination started. And so far, we believe that up to 6 months would be okay. Maybe longer, but definitely we have to wait for more data. And that's where, if you remember about the yesterday news, the Australian government has ordered more for booster dose. So that's the concept of booster has come because we know that the immunity keeps fading off with time, particularly with this type of viruses, and we have to give booster every year. And as per our experience with the flu vaccinations, initially we give 2 vaccines first time, 2 doses, 1 month apart, and then every year we give a booster dose. And that's the concept because the immunity dropped down and with time, somewhere between 6 months to 12 months, it goes to the stage where you are no more immune.
And how does COVID-19 and the Delta variant affect children? I mean, what is the viral load differences between adults and children?
Look, let's take it in this way. First way, that as a virus does not discriminate the age group. It affects everyone equally. Infection, probably you can say in children, so far what we have seen is relatively less common. And the reason which we not 100% sure, but it may be because of it may be because of the less exposure children have outside the world, and but we get more exposure in a public transport, in a work area. We as an adult we move out more, so that could be the reason. But the Delta virus has been changing the whole picture. So when the Delta virus has come up, more and more children are getting affected, and we have seen the experience back back from India, where Delta virus has affected the community most, and many young children and adolescents in even younger age have been affected, and have been very seriously affected. So that's because the Delta virus is more infectious, easily transmittable, more contagious, and likely to infect younger age group also. And that forces us, other way, you can say the more medical need comes now for us to think about vaccinating children too.
Okay. Yeah. I was just talking to a few kids, and I remember, there's one child who expressed his apprehension and said that if taking the vaccine will alter his DNA in 4 years' time. I mean, what do you say as a doctor? How do you quell apprehensions of children like these?
Look, it's a very, very important question you have raised. Not only children, I would say, even adults are apprehensive. And this apprehension I believe, is created. It's created by people, those who are against vaccines. There is no rationale behind it. It's not going to change your genetic makeup, your genetic structure, your DNA. It is a messenger RNA, mRNA, which control the protein production of the virus. So it's not going to link with your DNA and going to change your DNA structure and make you from a simple person to a horrible person, or make you, like if you remember the Fly movie, which I saw a few years ago, and you change your whole genetic structure, you change from human being to a fly. So it doesn't happen in that way in real life. That's only happen in Hollywood or Bollywood movies. So I don't think there is any scientific explanations for that. And also, I'm glad you raised these concerns. And there is also a myth that it will make, particularly for girls, that if you take messenger RNA vaccine, a Pfizer vaccine, it will make you infertile, and you will not be able to conceive for the rest of your life, which is another biggest myth created by a certain group of people, those who don't want the vaccinations to be taken.
And as we've seen, and as you rightly said too, there are a lot of mixed messages and conflicting messages coming, isn't it? Like, infectious disease experts have warned against using children as tools to achieve herd immunity. And then you also had the World Health Organization saying that wealthy countries should postpone their plans to immunize children and donate them to the rest of the world. But as we see now, there is a change that has come, and we're talking about vaccinating children. How has that change come about?
Look at it in this way. I think there is always ethical issues comes when we need to vaccinate children. Okay. First thing is, yes, it's a valid question. When we know relatively infection rate is less in children, and we have more high risk group in a community, age group, healthcare professionals, frontline worker, and in those who are working in aged care, and elderly people, high risk people with a disability, with a congenital heart issues, and people with lung issues, diabetes, those are at high risk that needs to be given priority, and they should be vaccinated. Those who are at high risk because of the chances of death is very high as compared to children where the death rate is less. So it comes to the ethical issues. Why do you need to vaccinate children when we have not enough vaccine to vaccinate the most needy one? And which I agree in that way. Definitely, if you look at this way, that the vaccine has been approved to use in children more than 12 years of age. But it does not mean that the children are going to get the vaccinations from next Monday onward. And because first thing is we don't have enough vaccine at this stage. So I don't see children would be able to get vaccination before the end of the year or early next year anyway. Okay, because we don't have enough vaccination, we have more into the priority list, those who need to be vaccinated particularly. And I still believe those who are in a high risk, they should be vaccinated. And particularly when it comes to the children, we need to vaccinate. I would probably advocate for children, those who are at high risk children, like children, those who are diabetic, children, those who have Down syndrome, cerebral palsy, or other severe mental health issues, children like autistic children, those who are, cannot understand what is the isolation is, how they, because of the sensory issues, cannot put tolerate the mask on their face. So they cannot isolate, they cannot keep a social distancing. So these are children with congenital heart issues, cystic fibrosis, congenital lung issues, chronic lung issues. These are the children with high risk. We should prioritize them first. They should be vaccinated first. Then we need to look into the other children when we have more vaccination available. Okay. The move also come up from other things because the Delta virus has changed the whole picture. As I said, initially, the primary initial virus, alpha virus, was not that infectious, was not infecting children. Now the picture is changing and it's affecting more and more children. So now one way you can say ethical responsibility, we need to vaccinate children with a high risk or adult those at high risk, but we also have the responsibility to protect children because the Delta virus is affecting the children, and we have seen children over the world dying because of vaccination. Because of the COVID itself. So vaccination will give them protection if we have availability of enough vaccination. And second thing, the biggest thing also is about the herd immunity. In general, we say that we cannot prevent the spread of virus, or we cannot prevent this pandemic or we can't stop this pandemic unless until we achieve the vaccination rate 80%. 80% minimum should be, more higher it is okay. How we can achieve the vaccination rate of 80% in our community when our children less than 18 years of age, how much is the population of children less than 18 years? Is 29%. So if we have a 29% children of less than 18 years population, so how can we achieve more than 80% without vaccinating children? And vaccine uptake rate in any community is never 100%. So even if we take 100% vaccinations rate for adult more than 18 years of age, we will be able to vaccinate only 71%. And vaccination is never 100%. So it's generally between 85 to 90% if we are a very committed community, we can achieve. So that means we would be hanging around somewhere between 50 to 60% vaccination rate in community. And this is what we are seeing happening in USA. The vaccination rate initially went very well up, and now it's getting plateaued and slowed down. So that's way to increase that vaccination rate, to reach to the stage of herd immunity, we need to vaccinate children too. Because otherwise they would be a sort of a harboring this virus and keep transmitting the infection to the community, number one. And number two, we have protected a certain group adult age, but now we will see more serious illness, death in children. And that's the reason we are pushing for the children should be vaccinated for these multiple reasons.
Okay. So when do you think kids in Australia will be included in the vaccine rollout? By what time? You said not till early next year. By what time?
Look, TG has approved last week, and then it has to go to ATAGI, ATAGI, which is a technical authority against immunizations, and give the advice. And I believe will take at least somewhere between 1 to 2 months to give advice. And then it will be coming into the sort of as a in general advice for the public. But it's not the advice only makes a difference. Here, make the difference is the availability of the vaccine. So, and then it comes to the priority list. So if we make the priority list, if we see how many people from the general public less than 40 are getting vaccination, Pfizer vaccination. They're hardly getting any vaccinations because we don't have enough. So what I would recommend that once ATAGI give a approval, the children, those who are at high risk, should be put on a priority list. And that's what I will be strongly advocating for this at this stage. The rest of the children group can be vaccinated by end of the year or early next year when more vaccinations are available, when more vaccines are available. So I don't see at least in few months' time, probably end of the year, till more vaccination slot come.
Okay.
But vaccination of children would be very useful also if we look into how much disruption children have in their education. So if we educate, if we see particularly the adolescent group, VC group, like, today there was a news in Sydney that, they want to cancel the year 12 exams. How long, it happened last year in Victoria. So this is just such a stressful condition, stressful whole time for VCE students, Victorian curriculum examination students, year 11, year 12 students. Uncertainty is over there. They are so much anxious, nervous. They're not able to sleep. They're having an uncertain future, whether I'll be able to get the university in next year in any course or not. What will be my task course this year? So that uncertainty can be controlled by vaccinating the children, so that we can say, okay, this group of children are vaccinated, can go to school. And I would also advocate the teacher should also come in the priority list over here, so that that group is safe and children education is not affected. And we can open school as normally as possible.
Okay, last question. Going forward, any last thoughts from you on this vexed issue of vaccination and children?
Look, I would say, as I said, I would be advocating for children with disability, children with autism, children with diabetes, chronic lung disease, cystic fibrosis, and Down syndrome or other severe disabilities, cerebral palsy. That should be in the priority list, and parents should come out to vaccinate, because the COVID can be more serious in these children because of the immunocompromised. They will not be able to tell, some of them will not be able to tell their signs and seriousness because of their mental health issues. And children like autism, they cannot protect themselves by social isolation and putting a face mask because of the sensory issues. So these children should be given priority, and teachers should be given priority, and so that we can open the school and we can see more healthy children rather than scared children sitting at home alone and stuck to the computer for homeschooling.
Thank you, Dr. Raj, so much for your time. You've addressed some key issues and concerns as well. Thank you.
Thank you very much. Thanks for giving me that opportunity again. Thank you.
Thank you.